I have to say, as a patient, a lupus patient, and somebody who is immunocompromised, I am hopeful that some of these preventive measures will stick around once the threat of this illness is gone. We've the lupus patients and the people that have been compromised have been kind of practicing this for years already, right? You're already aware of every illness. We wash our hands and we practice a little bit of social distancing, and we're aware of infection. So I really hope some of that sticks around after the major threat is gone.
Yeah, it's a good point because I think some of these CDC guidelines, like the guideline around hand washing, you could say that mother always told you to do this already, and so I think it is generally good practice for people who are immunocompromised, and I think it actually does reflect kind of a probably somewhat of a lack of awareness in the general population that serious infections are out there, and in the case of COVID, we're observing this on a grand scale, unfortunately, and that these things can happen. But it's true, I think that you're exactly right that people who've taken immunosuppressive medications have already been thinking about these issues, probably in a greater degree than many of us in the general population have been. I know as a physician who frequently prescribes immunosuppressive medications for patients, it does come to front of mind and trying to think about how to be proactive and prevent infections. So I think you're exactly right, is that some of these things will probably stay, and it's probably a good idea. I think some of the really restrictive things will ease because we are a social species and we'll want to interact with each other. But some of this is just good general practice, and it's I think this has been kind of a wake up call, and that some of it will